Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today I'm pleased to confirm that Manitoba Health is expanding COVID-19 vaccine eligibility to include children aged 6 months to 4 years of age. This follows the federal approval of the Moderna COVID-19 vaccine for children in this age group, as well as based on clinical guidance from the National Advisory Committee on Immunization. And while we will have enough vaccine for all children in the near future, our initial delivery is limited to 14,900 doses, which means we will have to initially prioritize who can get these initial doses. And so this is going to be based on guidance from NACI, based on our experience with COVID in Manitoba, and as well as expert clinical guidance from our advisory team. So we're going to first focus on the children that are most at risk. And so we'll be prioritizing in two ways. The first way is based on known medical conditions. So I'll list that those conditions here now. It's also available in the bulletin for review. So the medical conditions include chronic lung diseases, airway abnormalities, chronic or congenital heart issues or circulatory issues, those that are moderately or severely immune compromised based on disease or on treatment, neurologic disorders including developmental delays, diabetes, chronic kidney disease, or any chronic disease related to premature birth. In the second manner we're prioritizing is for First Nations, Inuit, or Métis children that are in this age group, regardless of where they live. And so we're still proud to continue our partnership with First Nation leadership to coordinate distribution to their communities. I know this day is a day that many parents have been waiting for quite some time. Many will feel that sense of relief that their child is now eligible. If your child doesn't fit these initial criteria, again, we reassure you that we should be receiving more doses in the near future. By the end of this month or early August is what we're expecting. And so there's about 76,000 children in this age cohort. And so we'll be expanding eligibility to all of them in the near future. So this does come as good news to many, and we look forward to having a high uptake in this age cohort. So certainly parents who have questions regarding this vaccine, please do contact your healthcare provider to get that information you need. So we know this vaccine has a very safe profile and is effective. It is a smaller dose due to the age and of this cohort, but still provides that strong immune response. It is a 2-dose series, and we're recommending an 8-week interval between the doses. And so this vaccine is expected to arrive by the end of this week, and then we'll be shipping it out to the vaccine sites, public health offices, and medical clinics. Parents and caregivers of eligible children will be able to begin booking appointments online or by phone 8 a.m. Monday, July 25. All these locations with the vaccine will be posted on our online vaccine finder map. Parents can use this to find a location that is convenient for them. So this expansion is something that many parents have been waiting for quite some time, and so we'll look forward to seeing a good uptake of this vaccine. And to continue, this is the next step in what has turned out to be by far the largest vaccine campaign in our province's history. So thanks again, and we can move to questions.
Given the limited availability, at least initially, how quickly do you expect the parents will be able to get their children at least that first dose?
Yeah, and so it's a difficult thing to measure, a lot of variables with that. We're going to have this as soon as we receive that dose, we're going to start shipping it to all the partners, we're going to have those appointments up. So a lot of that's going to be based on, how many people book those appointments early on. But again, we have that distributed channel, so it's going to be available at a lot of medical clinics, public health, and of course into First Nation communities. So a lot of variables there, but we hope to be continuing to open up the eligibility in the coming weeks to that entire age cohort.
For second booster shots, some provinces are moving to open it to all adults.
Right, yeah, so right now that's, we don't have a plan of expanding our the fourth dose or second booster dose campaign. A couple of things based on that, looking at severe outcomes, we see that those who have that initial booster are still well protected against severe outcomes. The fourth dose isn't showing us significant benefit outside those that are high risk, and those that are high risk are already eligible for that second dose. So we, just about 55% of eligible people have received their third dose. So certainly if you're in that category, haven't received your third dose and you're at a higher risk, we want you to be getting that third dose. For the fourth dose, same thing. If you're over age 50, if you have underlying medical conditions, immune compromised, then certainly consider that fourth dose. The other thing that we need to consider is that in early fall, there's a real chance of a bivalent vaccine that we begin our fall campaign with that is going to be very likely more effective against the newer variants that we're dealing with. And because there's going to be a 3 to 6 month interval between doses, a large fourth dose campaign right now could potentially delay the receipt of a much possibly better vaccine in fall. So a lot of variables there, but so we're not looking at expanding it, but we certainly want people to take advantage of the vaccines they're eligible for right now.
Can you explain that further? Okay, because I hear what you're saying about the new vaccines potentially coming in the fall, but why then is Manitoba not doing what other provinces have done and opened it up for a lot of people who are concerned? There's some people who aren't eligible under the immunocompromised categories, but it's been 8 months since they've had a third dose. So can you explain to them further why they don't even have that personal choice option of getting that fourth dose?
Yeah, well, I mean, some provinces have, many have not, and continued with the NACI recommendations on that second booster dose. So up until just recently, we've had very open fourth dose or second booster eligibility. So again, what we find is that those in lower risk categories who've had 3 doses have good protection against severe outcomes. Those that are higher risk are eligible for the fourth dose. And many people who, about half of people who are eligible for that third dose still haven't taken us up on that. So the real issue is getting people that first booster, and those that are high risk, then certainly the fourth dose, the second booster is available to them.
Will you be reopening the urban Indigenous vaccination clinics for the kids' vaccine?
There's work ongoing with, because we certainly want to have that accessibility to Indigenous partners, and so those clinics were very beneficial in that regard. So I don't have details on that. There'll be more to come on it, but we certainly need to continue to work with and allow our Indigenous partners to lead the way on vaccines, among other health issues.
Tell us about the current COVID situation right now with the new variant in the province, and what we're seeing. Are people getting sicker? Is the incubation period shorter? What are we seeing right now?
So with BA.5, we're at our last sequencing interval. We saw that BA.5 made up about half of our sequencing results, and so that's just a steadily increasing over the past many weeks, and we anticipate that will continue the trend. If we look at the risk assessment for BA.5, it seems very likely that it is more infectious than previous strains, that it does have some level of evasion of immunity, with the potential that being to increase hospital admissions. We see that in some other jurisdictions. Haven't really seen that here. The last modeling we have still shows a decline or plateau in our cases, but again, that modeling doesn't really take in consideration what we could see with BA.5. So we do need to be to still be aware of that.
What is the recommendation to parents though who have kids in the 6-month to 5-year range? The urgency, is it the same as it was when we first rolled out these vaccines for for adults?
Yeah, and so we know that with this age cohort, we've certainly not seen the same rate of severe outcomes as the older population and things. So certainly we've seen severe outcomes, and we've seen severe outcomes in children that say that didn't even have significant health issues. So it certainly does occur. Those that are at higher risk, it's much more important to the underlying medical conditions we discussed, Indigenous children. So we still want them to take advantage of this shot, and with that would be in the near future as you qualify for this, we'd encourage those people to receive that dose. Second dose about 8 weeks later. Those that say have already been infected with COVID, then we'll wait a recommendation of 8 weeks prior to getting that vaccine. So yeah, we're certainly recommending it, especially in this cohort right now, which represents the higher risk children.
Some persons say that the super clinic RBC might close in September. Could you confirm that?
I'm sorry?
Some persons say that the super clinic RBC might close in September. Could you confirm that?
So, well, there'll be more to come on that. The public health is still going to be running large-scale vaccine clinics. So the geographic location may change to that, but the process, the ability to be seen by public health, the vaccine providers is all going to be the same.
You just described the urgency. How do you plan to get information to parents and caregivers of those kids in the youngest age group who might be hesitant?
Yeah, and so like through much of this pandemic, we rely on healthcare providers. They have relationships with many of these patients. We've certainly provided information to them. We're doing events like this. We have the bulletin, and so we definitely want to get that message out there.
Do certain pediatricians have the technical ability to administer this dose to kids aged 6 to almost 5?
Yes. Yes, no concern with the ability of pediatricians to provide vaccinations and provide information on that.
Given the Moderna vaccine, there were concerns with Moderna with younger adults. What are the risks to this age group?
So this age group in the studies had a very good safety profile. Really didn't see any of those severe outcomes. There wasn't any in the initial studies there reports of myocarditis or pericarditis. Certainly, it's a known risk with these vaccines. So certainly need to be aware of that. But that risk was highest in adolescents and in young adults. So with the 25 microgram dose, about a quarter of that initial dose of the Moderna dose has very good safety profile, and so parents are encouraged to discuss that with their healthcare provider, but this has been improved on that good safety profile, good effectiveness.
Dr. Roussin, given that BA.5 is showing to be more infectious, people are now returning to the office. We are not too many weeks away from kids returning to school in the fall. Can we see that there might be a resurgence of mask mandates or anything coming in the fall, and what is on the table?
Yeah, well, I mean, we don't have anything right now that we're specifically looking at. We know that certainly this fall we're once again going to be dealing with some uncertainty. We know, like you say, we're going to see BA.5 cases very likely climbing. How that's going to translate into severe outcomes is still not known at this point, and we're going to be expecting the return of the typical respiratory virus pathogens, RSV, influenza. So again, we're going to need to be quite aware of those risks as we go into the fall season, ensuring everyone's up to date on their vaccines, including the influenza vaccine. Those that are high risk are going to need to take extra cautions. And in things like masking in indoor public places, we may see a return to stronger recommendations based on that, based on what we see. And certainly we can't take off the table any public health interventions, but there certainly is none that are planned right now.
How are rapid tests at detecting these new variants, and how accessible? We know that the federal government aren't going to be supplying them later in the year. Is the province still looking at making those free for people?
Yeah, we're still going to look at a process for having access to rapid antigen tests. right now, it's still diagnosing BA5. It's too early to know what the actual accuracy is with that and how it might change over time. And so this will all be things that were based on our, on our plans. We're going to be, regardless of any of that in this fall, we have to sort of deal with things in that syndromic measure, right? Staying home when you're ill, and those that are high risk presenting for for care.
How confident are you that the bivalent vaccines will be ready for fall?
Well, again, a lot of variables, none of which I have any control over, so it's hard to provide a specific sort of level of confidence with that. But from what we're hearing, there's a effective bivalent vaccine that by early fall could very well be approved and be used in Canada. But again, a lot of variables for that, and certainly that's not based on any, specific information or any, certainly nothing that's guaranteed.
Does the government have any data on what percentage of the population follow recommendations versus mandates? Because anecdotally, it seems that most people aren't following recommendations. So when you talk about perhaps having stronger recommendations in the fall, do you have any evidence to show that people might follow the recommendations?
Yeah, that'd be a hard thing to measure. Certainly, over physicians, healthcare providers provide a lot of recommendations on a lot of topics, and so people follow them to some degree, and others don't. So again. There's a lot of health issues that we provide recommendations and not mandates about, and it's all based on the overall severe outcomes that we're expect to see or see. So yeah, we're not going to use any coercive means unless absolutely necessary.
Are you seeing a lot of mask use indoors?
It's certainly declined, over time, but you certainly see mask use in indoor public places. Hard to quantify that, but I mean, it's certainly not as high as it was when we saw extreme levels of severe outcomes and transmission.
Does it concern you that it's declined?
No, I think when we're dealing with public health restrictions and mandates for such an extended period of time, the better part of 2 years, we have to be able to use those when they're needed, or people will be fatigued and not use them when we really want them. So right now, that's not a that strong recommendation right now. And if we do, then we do hope that it will increase should we see more and more transmission.
Dr. Roussin, will parents be able to go to pharmacies to get their children vaccinated under the age of 5, or is it just going to be doctors' offices and super sites?
So for this initial rollout, we have these specific criteria. It's going to be just public health and the medical clinics. We're working on, as we get the eligibility criteria wider and wider, we'll be working on things like that.
What about pop-ups? Sorry, just on that note, forgive me. Just on, what about community sites or pop-ups? Are there plans for those again?
Yeah, still plans for that. So, like school-based immunization, certainly there's a lot of work being based on that, right? Because remember, over this pandemic, there's been a lot of the routine immunizations that have been challenged to get into kids. So we need to ensure that they're getting their routine immunization. So there's a lot of work being done in schools based on COVID. We're a little bit early on that. We're going to focus on this cohort right now.
What date will the first dose in this age group actually be administered?
Yeah, I don't. It's going to depend on a few things. There's always the issues with when you actually receive this and how soon we get it out. All I know for sure is that the appointments can start being made on the 25th at 8 a.m. and we'd expect the doses in arms not long after.
Just going back to fourth doses, can you just explain why Manitoba is not offering those second boosters to people in high-risk positions like frontline healthcare workers right now? Are we not seeing severe levels of infection among that group?
Well, so we offer it to people who are at high risk of severe outcomes, and so people who have the third dose, the first first booster still are showing good protection against severe outcomes. The evidence doesn't show a tremendous improvement with that second booster in those who are not at increased risk. And then again, because BA.5 is circulating, we're not sure on the effectiveness of this this vaccine specifically for that. And so, giving that fourth dose to prevent just infection is, again, not a lot of evidence out there. So what we want is people to get the vaccine that they're eligible for. Those that are over 50 can certainly get that second booster. Those with underlying medical conditions can certainly get that. And then, like I say, we are, planning and certainly looking at that more effective bivalent dose in the fall at some point.
Are we losing any doses right now? Are they expiring? There was so much demand at first and not enough supply, and then we got a whole bunch, and now are we wasting it? Is it going to go to other provinces, or what's going to happen?
Yeah, I don't know offhand on what which doses are expiring. We have enough dose for everyone who's eligible and wants that, and so we wouldn't change our eligibility criteria based on that. We would change it based on evidence.
How long do you think your models will be, or it'll take for your models to be updated to include the BA.5?
Well, so the models include the transmission that we currently see, and then they map it out. So so it's not like an additional variable is plugged into there. They just use what they see and then map out what is expected. So I would say with this next iteration, which right now we're doing every 2 weeks or so of modeling, with this next iteration, seeing that right now we're at about 50% BA.5, we're probably going to start seeing the level of cases be expected to climb significantly.
You said cases are still showing, the modeling showing a decline in
for
cases?
severe outcome for hospitalizations, yeah.
And what are we seeing just in general for cases right now?
Well, for cases, it's tough to measure, right? We're not doing a lot of testing at our sites, so it's very likely we're seeing an increase in transmission. Right now, we're just not seeing an increase in severe outcomes at this point.
Sorry, how do you say that the last report we had for not last week, but the week before, showed a rise in COVID hospitalizations? So you got a new one coming out tomorrow morning. What does that one say?
A rise? No, the modeling showed still a decline or plateau of our hospitalization numbers.
How do you reconcile that with 2 weeks ago showing an increase from, forgive my memory, it was 13 more hospitalizations than the previous week?
Yeah, like you're just talking about absolute numbers in there. Then there's a lot of variables that go into the modeling, and so it's short. To see a relative increase in that much might not just sway the numbers. And if you look at the plateau, right, that plateau is starting to show that trend, right?
But you realize now this is a good illustration of why it would be great to have that data more public so we could see that data and not have this exchange right now. Would you not agree?
No, I'm not sure what the exchange is. It's
I don't understand how you're saying that our severe cases are declining when the last report that was public showed an increase in severe cases.
I said our modeling is showing a decline or a plateau in the severe outcomes. The last modeling, which was 2 weeks ago.
The actual numbers.
Right.
So what does the report say tomorrow? Forgive me, Brady.
I don't have a report tomorrow. I don't think there is a report tomorrow. It's every couple of weeks that we'll get a report.
Do you have any concern right now about hospitals and how we're going to be able to handle it if we are seeing increased cases? You said right now the severe outcomes are on the decline, but we are seeing that increase in BA.5.
Yeah, and so certainly you see across the nation there's a lot of strains in the healthcare system right now for various reasons, right? And so certainly any increased strain is going to add to that. Looking at other jurisdictions, and again, just from from reports I see, it's not necessarily COVID that's driving those strains. It's things like staffing and those issues. So yeah, so certainly we know the healthcare systems throughout the nation are under strain at this point, and anything increasing that we have to be very wary of.
All right, thank you, folks.